Alright, so we're going to do a review for Clinical 1, the physical exam, the eyes and ears. So looking back at all of the information that we've discussed for this chapter, I'm just going to go at random between the two chapters to see if you can remember some of this stuff. So when we're talking about the complete physical exam, try to remember what are the components of the complete physical exam. What all is included. So remember, it's on page 142. You have the health history, the physical exam itself, and laboratory tests. So those are really important. You've got to remember what all things are included in a complete physical exam. So what would be some of the reasons why a patient would need to have a physical exam? Well, we know that from what you're doing now in school. You might need one for school. You might need one for a prerequisite for an employment opportunity. So we call those pre-employment. It very well be for our kids that are trying to do sports at school. Even for some summer camps, the camps require these students to have an exam before they come. So there's several reasons, even like insurance physicals. So there's all kinds of reasons why patients should need a physical exam and why we would want to do some. So if you remember, we talked about different parts of the exam and different terms that the physician's going to be using. On page 142, we talked about the prognosis, and it is different than the diagnosis because the prognosis is actually looking at the probable course and outcome of the disease, whereas the diagnosis is actually defining what the actual disease process is. Alright, so we also talked about on page 142 the different types of diagnoses. And it's very important that you remember the different types. So for instance, I'm just going to pick out one. The clinical diagnosis. It actually is the one that is the tentative diagnosis that the physician is obtaining through their evaluation of the health history and in combination with the physical exam. So the clinical diagnosis, this is what they're saying is their tentative diagnosis that they derive from what they have evaluated in their health history as well as what they have found in the physical exam, and that's on page 142. Alright, so what about the differential diagnosis? What's different about that? Well, with that one, you've got two diseases that could have similar symptoms and causing the patient's problems. So you got to have a differential. You got to figure it out. Which one is it? Okay. So you need to understand the difference between chronic and acute, and what are some examples of chronic and acute illnesses. So if I were to say an acute illness, we could say the flu. That's something that is going on right now. It's an acute illness. It should be gone within a short period of time. And with acute, that is a time frame of about 3 months, versus a chronic, which would be something that lasts for a very long period of time, such as arthritis, diabetes, heart disease, those types of things. So understand the difference between chronic and acute and what some examples of those illnesses may be. Alright, so what is a risk factor? If you look on page 142, it describes to you what a risk factor is. So basically it's that those chances for a patient are increased for developing a certain disease. Like if they smoke, they have an increased risk for having cancer. Okay, so that's just an easy one we can kind of relate to. Okay, what about a therapeutic procedure? When you think of therapeutic, it's something that's going to make things better. And what I would typically say a therapeutic procedure would be like an antibiotic injection, because it's going to help make things better. I'm not talking about a diagnostic test. I'm looking at a procedure to make them feel better, and that's explained on 143. Going into some of the instrumentation that the physician's going to be using during their exam, you need to be familiar with those different pieces of equipment, their instrumentation like the otoscope, the ophthalmoscope, their stethoscope. What are all those? What are they used for? How would it function? Kind of like if I were to say, okay, what is the function of a speculum, whether it be a vaginal or a nasal or an ear? It's going to hold those tissue pieces apart, all that extra tissue away and apart, so we can see down into that orifice. Okay, page 144, 145, we're looking at how do we identify our patients? When we are calling our patients back, how do we identify them? You know, if you've been in any of our other classes, you've got to have at least 2 identifiers, and we use their name and their date of birth. Big thing. If you don't remember that, we will get you on a checkoff. You've got to be able to identify your patient, because you don't know if you have the right one. There might be 2 Tom Smiths out in the lobby, and they both thought you were talking about them. Okay, page 145. What is mensuration? That's kind of a weird word that you almost think about menstruation, but it is not. Mensuration is actually what we define as the measuring process. So we do mensuration when we are measuring height, weight, those types of things. So when we are talking about weighing, why would we weigh a child? What would be some of the reasons why we would need to weigh a child? That's on page 145. So if you are thinking ahead and thinking about pharmacology, or maybe you're even thinking about the last time you might have had to give a child some medicine, we have to know how much they weigh so we can decide how much medication it is safe to give them. We also want to make sure that they are growing appropriately. So we're looking to see, are their growth patterns normal? Are they having any significant nutritional needs that need to be addressed, whether they're eating too much or not enough? We got to look at those things. And how do we weigh patients? Well, we have to use a scale. And if you remember, we look at page 149 and 150. This is looking through your textbook at the procedures for doing weight. It actually is going to show you a scale, a weighted scale, that we would measure a patient's weight with. So that bottom row is divided into 50-pound increments, and the top row is divided into quarter-pound increments. So we do the bottom row first, and then we move to the top row to actually define someone's weight. So if we are actually looking at a patient's weight in pounds, and we need to convert that into kilograms, do you remember the math equation that we use? Well, we take the weight in pounds and we divide that by 2.2. So 1 pound is actually equal to 2.2 kilos or kilograms, and that's why we do that actual math equation to figure that out. Okay? Now, when we're working with patients, we need to use proper body mechanics. Why is that? Well, you got to protect yourself. If you're hurt, then you're no help to your patients or your physician, and we want you to be healthy. You've got a long career ahead of you, and once you have an injury, it's hard to be patient and wait to get better, but it's really hard to stay better. So try not to hurt yourself and get those musculoskeletal injuries we get with lifting. So try to push and pull. Pushing things away from you are about the easiest way to prevent a back injury. And then also using like a Hoyer lift, or hey, ask somebody to help you. That's always wonderful. So let's move on to page 154 through 156, talking about those proper body mechanics. Some good things to keep in mind while you're concentrating on your proper body mechanics. Look at how you can make things easier in your work environment. Store your lighter things in closets on the top shelves, or the tiny things that you're using most frequently right there, eye level. Do not put your heavy stuff on the top shelf. Oh my heavens, don't do that. Lift with your legs and your arms, not your back. So use those really good examples that they have there for you in your textbook. Looking at assisting a patient, and let's say that when you're assisting a patient to a different position, or maybe moving them from a chair to a wheelchair or back and forth, they start to fall. What are you going to do? Well, if they start to fall, you're going to follow those instructions there. Form a wide base of support with your legs and gradually lower that patient to the floor. Do not try to hold them up with all of your weight. You've got to gradually ease them to the floor, okay, because you're going to hurt yourself. Just be very, very careful. And remember, you're going to just use proper body mechanics every time you lift up things that are heavy. And you're going to be surprised at the things that are heavy that you're going to be exposed to moving around in your office. So let's talk now about draping our patients and getting them ready for the exam, the different positions that they're going to be in. You need to understand these positions. You need to understand why the patient would be in these certain positions. Why do we drape a patient? The big thing is we're trying to keep them warm, but most importantly, provide them with some modesty. Look at the lithotomy position. Why would we put a patient in the lithotomy position? Well, if we need to do a pelvic exam, then we would actually put them in that lithotomy position. Just go through and understand how those positions look. Be familiar with the pictures. Be familiar with the name, how it's spelled, and what type of exam we would be doing if we had the patient in that position. Okay? So let's also look at why we would do different portions of an exam, like palpation, inspection, auscultation, and percussion. Why are you going to be doing these things? What are they, first of all, and why would you be doing those things? Some examples of why you would be doing those things. So for us and for your physician, let's take, for instance, palpation. We can palpate an area that is painful for a patient. Maybe performing a breast exam. We're going to encourage our patients to do breast self-exams, and they're going to do those at home, so they're going to have to palpate. So understand those different portions of the exam, why we're going to do it, and at what portion we might need to do that, and for what areas. Okay? Alright. Now, while we're taking our patient back to the exam room, what's something that we need to remember to tell them to do, or ask them if they need to do? Yes, do you need to go to the restroom? Why is that? Well, we might need to get a urine specimen. The big things are, we do want to make the exam easier for the patient and the physician, so we want to give them an opportunity to be more comfortable and empty their bladder. So those are some big things to think about. Alright, now look on page 144, 171, and 196, and look at what some of the different instrumentations are, what we would be using them for during an exam. You need to be aware of what your responsibilities are as the medical assistant during the physical exam. And moving into the eyes and ears, if you'll look at page 199, we're looking at the reasons why we would do eye and ear installation as well as irrigation. What are those reasons why we would be doing those things? What kind of problems would a patient come in for us to do these things? Looking at a way to look into a patient's ear or to maybe irrigate an ear. What kind of technique do we use to prevent damage to that tympanic membrane? Remember, that's the medical term for your eardrum. For your adult patients, you're going to straighten that external ear canal so you can see down into the ear canal without hurting them. Why do we have cerumen? What is cerumen? What's the purpose of it? What are the ways that we actually assess visual acuity? What is visual acuity? Remember, that's the sharpness of vision, and we're going to check far vision with a Snellen eye chart. Remember, that's the one that's hanging on the wall, and we stand across the room 20 feet away, and we have a patient to read that chart. And then we also can do near visual acuity, and we typically do that with them holding a piece of paper at about 14 to 16 inches away from their eyes, and we have them start with larger font and move down. And it's just like assessing their distance vision on that Snellen chart. We're going to be able to give them a value and add that to their documentation in their medical record. Okay, I think those are the biggest things we need to remember from the physical exam, the eyes and ears. So make sure that you have studied this chapter very well. Make sure that you are watching the videos for the procedures and doing the extra activities that are available to you through the Health Science Resource Center and through Evolve Elsevier, the publisher for your textbook.